Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the etiology? What is the etiology of optic neuritis? Optic neuritis can be either idiopathic or it can be due to, see, these are the main causes. Optic neuritis can be idiopathic or it can be ischemic causes like arteritic and non-arteritic. Acute ischemic optic neuritis is seen. So based on the ischemic features, it can be either arteritic or it can be non-arteritic acute um, um, optic neuritis. Second, we have viral infections. Actually, viral infections it can occur, optic neuritis can occur due to a whooping cough, or it can occur due to measles, mumps, or varicella. Then we have demyelinating disorders like multiple sclerosis and Devick's disease. Devick's disease is neuromyelitis optica. So all these are responsible for optic neuritis. Then even metabolic disorders. Then even the metabolic disorders like or nutritional deficiencies like vitamin B1 deficiency, vitamin B2 deficiency, vitamin B12 deficiency, folic acid deficiency, and diabetes mellitus. All these are the nutritional causes of optic neuritis. Leber's hereditary optic neuritis and some infections like Lyme's disease, syphilis, cat scratch disease, cryptococcal meningitis in AIDS and tuberculosis, and toxic amblyopia. All these are responsible for optic neuritis. Among all these, what is the most common cause of optic neuritis? The most common cause of optic neuritis is multiple sclerosis.
thank you and thank you for watching.